Good day, everyone. I will be discussing the topic epilepsy. Epilepsy is a common disorder of the brain, causes recurring seizures. Epilepsy affects people of all ages, but children and older adults are more likely to have epilepsy. Seizures are the main signs of epilepsy, and most people can control this with treatment. In simplest explanation, epilepsy is a condition that causes repeated seizures. It can affect people of any ages but is more common in children and older adults. Seizures are the main symptom and the most people can control them with, of course, treatment. For the summary of um, its etiology, in older adults, epilepsy is sometimes caused by other brain problems like a stroke, tumor. It can also be linked to genetic issues, past brain infections, injuries before birth, or developmental disorders. But for about half of people with epilepsy, the cause is unknown. For its pathology or pathophysiology, pathogenesis, epilepsy is characterized by recurrent seizures resulting from abnormal electrical activity in the brain. Epilepsy happens when unusual electrical activity in the brain leading to repeated seizures. This is caused by changes in how brain cells works, problem with brain chemicals, and sometimes changes in the brain structures. The natural causes of epilepsy can vary significantly among individuals, influenced by factors such as the underlying cause, seizure type, and treatment response. Understanding this course involves examining the phases of seizures, potential progression of the condition, and the long term outcomes of individuals with epilepsy. For the phases of seizures, epileptic seizures typically unfold into three distinct phases. First one is the prodromal stage. This is the warning phase before a seizure where person might feel unusual or have small symptoms like feeling irritable or tired, but seizures hasn't happened yet. The ictal phase is the actual seizure itself, where abnormal brain activity causes the person to have a seizure. And lastly is the post-ictal phase. This is the recovery period after seizures, where a person may feel confused, tired, or have a headache as their brain settles back to normal. The progression of epilepsy is not uniform and can be influenced by several factors such as etiology, the seizure frequency, response to treatment, and cognitive impact. Long term outcomes. Prognosis for individuals with epilepsy varies widely. The control seizures, intractable epilepsy, and the quality of life. In summary, the natural causes of epilepsy encompasses a spectrum from well-controlled seizure to more severe forms that can affect cognitive function and quality of life. Understanding these dynamics is essential for tailoring treatment strategies and improving outcomes for those affected by this condition. The clinical features of epilepsy is characterized by recurrent seizures, which can manifest in various ways depending on the type and location of the seizures activity in the brain. Types of seizures: generalized seizures, the tonic-clonic seizures or the grand mal, absence of seizures or the petit mal. The focal seizures: simple focal seizures, complex focal seizures. The common symptoms is the loss of consciousness. It varies from brief lapses to complete unresponsiveness. We also have motor symptoms or jerking movements, contraction or stiffness, the sensory disturbance, unusual sensations such as smell, taste, or visual change, and lastly is the emotional changes. Sudden feeling of joy, fear, anxiety occur before during the seizures. Postictal state. After a seizure, individual may experience confusion, fatigue, headaches, or muscle soreness. This recovery phase can last from minutes to hours. Associated risks. People with epilepsy face higher risk of injuries from falls or accidents during seizures and may also experience psychological issues such as anxiety and depression. Understanding these clinical features aids in recognizing and managing epilepsy effectively. For the epidemiology of epilepsy, it is prevalent neurological disorder affecting approximately 50 million people globally, making it one of the most common condition of its kind. Prevalence and incidence. The estimated prevalence of active epilepsy ranges from 10 to 10 per 1,000 people in general population, with higher rates in developing countries where it can be between 6 to 10 per 1,000. Annually, 5 million people are diagnosed with epilepsy worldwide, with rates reaching 139 per 100,000 in low and middle income countries compared to 49 per 100 in high income countries. Demographics. Epilepsy can develop at any ages but is most common in young children and older adults. New cases peak in children under 1 year and again in those over 55 due to factors like stroke or neurodegenerative disease. Nearly 80% of individuals with epilepsy live in low and middle income countries where access to the treatment is often limited. Treatment gap. Approximately 75% of people with epilepsy in low income regions do not receive adequate treatment due to various barriers, including lack of access to medication and healthcare resources. Economic impact. Epilepsy imposes significant economic burdens, with unusual cost treatment and care reaching billions. In India alone, the economic burden was estimated to 68.75 billion or about 1.72 billion. For the investigations of epilepsy, medical history and physical exam, detailed medical history gathering information about the patient's seizures including their frequency, duration, and characteristic is crucial. Accounts from witnesses can provide valuable insights since individuals often have limited memories of their seizures. Neurological examination. This assesses the patient's motor skills, reflexes, sensory functions, and cognitive abilities to identify any neurobiological deficits. Electroencephalography or EEG. We have the standard, ambulatory, and video EEG monitoring. This is the gold standard for diagnosing epilepsy. It records electrical activity of the brain, can detect abnormal brain wave patterns associated with seizures. For the ambulatory extended monitoring, this portable version allows patients to record brain activity over several days while going about their daily activities. Video EGG. This combines EGG with video recording to correlate seizure activity with observable behaviors, helping to confirm seizure types and location. We also have neuroimaging techniques. This includes magnetic resonance imaging or MRI, the computed tomography or CT scan, single photon emission, computed tomography or SPEC, and positron emission. The other one is additional diagnostic test. The magnetoencephalography or MEG, magnetic resonance spectroscopy. For the MEG, this is a non-invasive technique, measures magnetic field generated by neural activity, providing insights into the brain function, seizure localization. MRS analyze chemical compositions in the brain tissue, aiding in different epilepsies from other conditions like tumors or metabolic disorders. We also have the blood test, may be conducted to rule out the metabolic or genetic disorder that could contribute to seizures. Developmental and behavioral assessment, and that's it. For the diagnostic procedures, we have medical history and physical examination, the EEG, neuroimaging techniques, and again blood tests, additional diagnostic tests. The diagnostic procedures for epilepsies are comprehensive and involve a combination of clinical assessments and advanced imaging techniques. Accurate diagnosis is essential to determining appropriate treatment strategies and improving outcomes for individuals with epilepsy. Pharmacological therapy. Pharmacologic therapy for epilepsy primarily involves the use of anti-seizure medication, which are designed to control seizures, improve the quality for the individuals with epilepsy. Non-drug therapy for epilepsy encompasses various approaches that can complement or serve as alternatives to pharmacologic treatments. Under the non-drug therapy is the surgical interventions, vagus nerve stimulation or VNS, ketogenic diet, deep brain stimulation, complementary therapies, lifestyle modification, the most common, the trigeminal nerve stimulation or TNS, biofeedbacks and neurofeedback. The prognosis of epilepsy varies significantly among individuals and influenced by factors such as seizure type, age of onset, response to treatment, and underlying causes. Under this is the control seizure, treatment failure, factors influencing prognosis and quality of life. While many individuals with epilepsies can achieve good seizure control, a substantial number remain refractory to treatment. Continuous evaluation and individualized treatment plans are essential for optimizing outcomes and improving the quality of life for those affected by epilepsy.